Namaskar, I am Dr. Ayan Basu. I am the head of radiation oncology at HCG Cancer Center located in New Town of Kolkata city. Radiation oncology constitutes one of the most vital parts of the armamentarium of all cancer doctors used for treating cancers, and about 70% of all cancer patients will be requiring radiotherapy as a part of their treatment during the journey of cancer treatment. Radiotherapy uses very high energy X-rays to kill cancer cells and constitutes a painless mode of cancer treatment. It is basically used for local regional treatment either by its own or as a complement to surgical management of cancers. And often we also use systemic therapy like chemotherapy or hormonal therapy or immunotherapy in addition to surgery and radiotherapy for the management of these cancers. So essentially, radiotherapy is a painless form of local treatment of cancers, which remains a very important part of the cancer treatment armamentarium. I am often asked this question as to whether the patient is going to find it painful to take a course of radiotherapy. So the side effects that we have during radiotherapy are generally divided into two groups. One, those which happen during the course of radiotherapy and immediately afterwards, and those which happen as a long term. Now, if we discuss cases of radiotherapy where the patient is receiving radiotherapy, say for example to the head and neck region, what typically happens is that as radiotherapy progresses, as a course of radiotherapy progresses, patients sometimes develop an inflammation of the inner lining of the cheeks and the gums, as a result of which they feel that radiotherapy is causing a little bit of burning sensation mostly. It is not really painful. Radiation per se cannot be felt in the body because they only employ high energy X-rays, which, as you know, even from your experience of CT scans or diagnostic X-rays, that they cannot be felt or perceived by the patient when it passes through the body. However, as a result of radiotherapy, when cancer cells get knocked off, they leave behind slight raw areas. During the course of radiotherapy, patient might find that there is a little bit of irritation or burning in the areas which are being exposed to radiation. We doctors, we radiation oncologists generally give local anesthetics or soothing agents which basically help the patient to tolerate the full course of radiotherapy uneventfully, and these side effects typically pass off once the patient has completed the course of radiotherapy, so it is nothing to be frightful about or scared about, and they are well tolerated. Regarding the long-term side effects of radiotherapy, mostly for head and neck cancers, it is basically a situation of slight dryness of the mouth, and there are certain simple measures like, for example, using soda water gargles which can help the patient to prevent it or ameliorate it to a large extent.